So today we're going to be talking about the UNC 12 probe. This instrument has a handle, it has a shank, and it has a working end that is blunt, slender, and rod-shaped. The working end and shank meet in a defined angle that is usually greater than 90 degrees. The probe has millimeter markings on the working end that measure up to 12 millimeters. So the UNC probe is an assessment instrument that detects and measures periodontal pockets and determines the overall health of the periodontium. Indications for this instrument include measuring the sulcus, periodontal pocket depth, clinical attachment levels, and amount of attached gingiva. The probe can also be used to measure the dimensions of small lesions, diastemas, and overjet. It can also be used to evaluate tissue tone as well as gingival bleeding. Some contraindications for the UNC probe are titanium implants and recent oral surgery. The grasp used with this is the pen grasp or the modified pen grasp. It should be light. So you're going to have your thumb and your pointer here in a soft C. The middle finger rests on the shank, and your ring finger will be your fulcrum. And you can have an intraoral or extraoral fulcrum with this instrument. And again, you're going to use light pressure with this instrument. Okay, so now we're going to talk about how to properly read the measurements on the probe, as well as the proper angulation and adaptation of the instrument. So you're going to be measuring the probing depth, which is the measurement from the gingival margin to the base of the sulcus or the junctional epithelium. And once you reach the base of the sulcus or the junctional epithelium, the tissue should blanch. So the probe should be inserted always towards the apices of the tooth, and it's in line with the long axis of the tooth as well. So as you're inserting, it should be the working end is tilted away from the tooth so that the tip of the instrument is always in contact with the tooth. So when the probe enters the sulcus, once the tip of the instrument disappears, that's a 1 millimeter measurement. When the first line disappears, that's a 2 millimeter measurement. Once the second line disappears, that's a 3 millimeter measurement. Once the third line disappears, that's a 4 millimeter measurement. Once you are into the black band, that's a 5 millimeter measurement. And once you pass the black band, you are at a 6 millimeter measurement, and so on and so forth. So now we're going to talk about the working order as well as how to actually take the measurements. So the working order for the UNC probe is you're working from tooth number 1 to tooth number 16 on the buccal surfaces. Then you're going to do 16 to 1 on the palatal surfaces. Then you'll go down to tooth number 32, and you're going to do 32 to 17 on the buccal surfaces. And then you're going to do 17 to 32 on the lingual surfaces. The tooth is divided. Every tooth is divided into 6 sections, and the 6 deepest measurements per tooth are recorded. Okay, so you're going to enter the probe at the distal line angle here. Okay, and then you are going to make sure it's angled towards the apex, and now you're going to use a walking stroke at the base of the sulcus so you get interproximal. And once you can't walk any further, you're going to tilt the end of the instrument 10 to 15 degrees into the call space. Okay, and I have a 4. Now you're going to remove the instrument. You're going to go back to the distal line angle, and you're going to walk the instrument, and you're going to record the deepest measurement there, which is a 6. Now I'm going to walk it from the mesial line angle to interproximal, again using the walking step, and then I'm going to tilt the instrument into the call space, and I have a 6. And now I will do the same on the palatal. Okay, so I'm at the mesial line angle here, inserting, and I'm going to walk it, I'm going to tilt it, and I have a 4, remove it, put it back to the mesial line angle, and now I'm going to walk. Okay, and I have a 3. And now I'm going to tilt it. And I have a 3 again. Okay, so now I'm going to demonstrate on 3 other teeth. And just keep in mind that we are starting at the mesial line angle now that we've crossed over the midline. Okay, so I have a 6. A 5. a 7, 6, 6, 7, 6, 7, 7, 6, 6, 6, 6, 6, 6, 6, 6, 7.